Hello, for those of you who don't know me, I'm Rebecca Bowers, DO, and I just wanted to share an encounter that I had this week in the office. So it's a 7-year-old girl who was brought in by her mother for an osteopathic manipulative medicine evaluation checkup. I've seen her since she was 4 years old. And it can be a good idea to have kids come in periodically, adults too for that matter, but especially children because they are often running around, bumping into things, um, kind of getting these dysfunctions. And yes, oftentimes if they're mobile and moving around, that kind of wiggle them out themselves. But sometimes for variable reasons, a dysfunction, just the body can't seem to quite get it wiggled out. And so the sooner you can catch it as they're growing, then the less time they've had to grow into that dysfunction and organize things around that dysfunction, which is not really something ideally you want to happen often ever, but especially when someone is growing, because then they're going to grow around with and compensating for that dysfunction. So she came on in for that, and when she's standing, I put my hands, head, neck, shoulders, and it just felt tissue texture wise like the immune system was doing something. It was warm, it was boggy, so kind of squishy, extra fluid in her tissues here. And so I put my hands in the front of her neck, and she's got 2 enlarged lymph nodes here on submandibular, one on the right a little bit lower down, not as big as on the left, and her lymphatics on this right side are just they're just squeezing. Those lymphangions are squeezing, trying to drain everything back down this direction. The left side, I'm not feeling that at all. It's just very still. Something is inhibiting it or in the way, and it's not moving. So I start asking questions. Has she been feeling ill? Any kind of upper respiratory symptoms, cough, fever, sore throat, all that stuff? Is anyone she's around ill? No. Sore throat wise, mom says that on and off, just in general, she will sometimes mention that her throat feels a little sore. So it's been feeling a little sore the past couple days, but not really hurting, not super sore. So looking in her mouth, there is the mucous membranes are moist, so she's well hydrated. She looks healthy. Inside, it doesn't look red and raw and angry, but it does look like a darker pink, like the blood or the fluids are kind of in there. The tonsils are not enlarged, there's no pus, anything on them. Kind of looking around the mouth, mom tells me, oh, she just went and saw the dentist last week, and they did a cleaning and then also evaluated. She uses a myo brace at night for her jaw teeth expansion. And so yeah, it doesn't look too bad. Look in the ears, they look totally good. Glance up the nose. That also has that kind of darker pink, like fluid, something's going on. The mucous membranes don't really have that blue hue that sometimes they'll get if there's chronic allergies. Also, the way the lymph is really just jamming. You can get the lymphatics kicked up when you're fighting off allergies from pollen or whatever bothers your immune system, nervous system, and the nasopharynx, but it usually doesn't have that same vigorous kind of warm feel. It has more of just like a draining the gunk kind of a feel. So asking questions like, how often do you change the toothbrush? Every 2 months they do a new one. Is there a glass of water that just kind of sits in the bathroom like some people do and maybe has gotten some kind of nastiness in it unknowingly? No, there's no cup of water that they use after they brush their teeth or anything like that. The myo brace, it is cleaned. It during the day sits out exposed to air on a napkin, so it's probably not getting covered in a bunch of nastiness either. Trying to look like for a source of where what is this coming from, because it just really seems like it's coming from in here somewhere. So following the path of where is this lymph draining from, like I said, left, not really feeling it. Following up the right, it's like this, and it's coming from that left side over here, up near TMJ, and this area here really feels like the lymph is like pushing it from deep to superficial, like, and then that it's traveling over to here. So the way our lymphangions are smooth muscle and they go around the lymphatic vessels, they can kind of alter the way that they push a little bit. Pushing backwards isn't necessarily helpful because the lymph vessels have valves, and so it's not really going to work to be able to go backwards. But based on some of the crosstalk that we have with our lymph vessels, it is possible that instead of going like this, if for some reason these aren't firing or something's in the way where they just can't move the fluid through, there is an ability to kind of direct things over towards freedom so that things can drain. But still, that's going to be just one side doing both sides instead of draining where there's apparently feeling like there's a problem. So it feels like it's coming deep from in here. So pushing through cheek to get a sense of what's going on at gums right about here. Deep is actually, the lymph is kicking it right there. So I'm like, all right, we're gonna look a little bit more thoroughly at this tooth here. So go in and look at it, and sure enough, just barely, like right at the gum line around that molar, it's just barely a little bit red looking, a little bit irritated, where you almost have to imagine it knowing that something is going on there. But it matches up with the lymph, and the thought being that, you know, you're getting your teeth cleaned, something can get scraped, bacteria, if the wrong ones are in the wrong spot at the wrong time, can sometimes take advantage of that situation and start proliferating. And in an ideal situation, you're draining your immune system cells, they come in, they kill off the invader and restore normalcy. But if you don't have that flow going on, then if you think of like a pool, if the filter isn't working, if you think of a pond where the inlet or the outlet, something is happening, that stagnation just causes things to build up and get nasty. So essentially, then what happened is because she wasn't draining well, likely that then it's able to be trying to get an infection going in there. Obviously, it is doing something enough where her lymph nodes are enlarged over on this side. So worked on her, freed up restrictions, and got better coordination of the lymphangions to go and actually be draining both sides. Once the left actually started to be able to drain, the right slowed down some, not to a point of like a dysfunctional slowing down, but like that it wasn't having to do like double time anymore, because now the left was doing rapid to try to drain out the area, and the right could just kind of do its draining slightly more rapid than normal if there hadn't been anything going on, but more appropriate for the problem actually being on the left side, and the left side now able to drain. So mom wanted to play it conservative, which makes sense because child looks good, no fever, feels good. And so basically it was, well, we're draining now, let's swish around some mouthwash in there to help kill the buggies that way, reduce sugar consumption for the next few days so that we're not feeding those bacteria, and take a peek in there and see if it looks like it's getting worse, or if it starts hurting or fevers or anything like that, then that would be an indication that, yeah, maybe we should throw some antibiotics at it. But I just thought it was an interesting case demonstrating how useful it can be to feel how the lymph is flowing to trace back to a source, but also if it's not flowing in an area that has a problem, that is potentially a really big problem. And in some cases, you can throw antibiotics at things, and even that isn't going to be enough depending on other comorbidities going on with the patient. So really, lymph optimization is an important palpatory and treatment skill to have in your toolbox. I do have a video on beginning to feel the lymph as far as treating it. There's many different ways, but opening the drain is a very good first step, so knowing where things drain towards, and then also being able to interact and feel function and the nervous system, and drawing its attention to an area, interacting with it. Oftentimes, as long as structurally things are open, you can get the nervous system to realize, oh yeah, I'm supposed to be doing that, and I can start doing that now again because I'm not just like hitting up against a wall. Things are free now, let me do what I need to do.